Hello all, thanks for joining me today. It seems like I've been signed up for this course for 2 years now, but I'm super excited for all the content we've gotten out of it already. And I want to, before we get started, thank Matt and the whole team at South Coast Seminars for putting together such an awesome ACL study day with great presenters and awesome information. My hope is to spend the next 20 minutes or so talking about objective knee strength testing and how you can bring that to your practice with your athletes and why it's so important. So let's jump right in. This is me. My name is Jacob. I'm full-time PT practicing in Dallas, Texas. These are my channels. You can find me on Instagram, Twitter. My website's up there and my email address. So if you got questions after this presentation, feel free to reach out to me. If you're interested in all in objective strength testing, or especially handheld dynamometry, definitely check out that Instagram channel because I post exclusively about test positions and setups and things like that. So let's jump right into it. Key point number one is hopefully if you guys are interested in ACL rehab and recovery, you're taking this course. We all know that strength is important. Hopefully that's a given. So we're not going to spend a ton of time on this, but I do want to highlight a couple of different aspects of why strength is so important for ACL athletes. We know that deficits start early and persist for a long time. We know that restoring full strength gives us a higher likelihood for full return to sport. We also know that restoring strength reduces injury risk and reduces the long-term risk of developing osteoarthritis. So these are all really important factors for the athletes that we work with. The first study we want to highlight is looking at the really acute phase. So what they did is they compared a control group of healthy normals to a group that has recently ruptured their ACL, but before they've had surgery. The mean time frame was about 23 days, so a little over 3 weeks after their injury. And really they were interested in looking at hip and knee strength, trying to tease out if there were any hip factors that they felt like may be related to injury risk. But their primary finding with this group was that the only real difference they saw was a big deficit in knee extension strength. So quad strength was nearly a 25% deficit already, even 3 weeks after injury. Now we don't know how much of that was present before the injury and how much kind of appeared after the injury, so it's tough to tease that out. But either way, we know that these deficits appear pretty quickly. The next study we want to look at is a systematic review that's looking solely at quad strength and activation after ACL reconstruction. So they reviewed 28 studies and they noticed that kind of pooled all of them together to see what the quad strength for this group looked like. And even longer term outcomes, we're looking at about a 82% symmetry index. The injured group showed a torque of 2.38 Newton meters compared to that 3.0 standard that we're normally looking for. So, a really big population we're looking at here, and we see, still big strength deficits. Most of this presentation will be focused on knee extension and quad strength, but we don't want to neglect the hamstrings. We know those are important too. This study looked at 158 athletes and found for every 10% decrease in hamstring to quad ratio, there was a 10.6 times higher risk of a second injury or a re-rupture. So we know that ratio is important and that hamstring strength is also paramount. Next study we're looking at is trying to determine, okay, well, who returns to sport and what are the variables that are important for that? And as you would expect, those that return to sport, kind of across the board, did better with functional tests and isolated strength testing. But really, the biggest deficits that we see are, again, quadricep torque and hamstring torque. Their LSIs really aren't even close to what our thresholds would what we want them to be. We'll spend a little bit more time on this article. This is 2017 JOSPT, kind of looking at, for those athletes that got cleared to return to sport, are they actually meeting our kind of verified return to sport test thresholds? And they noticed that only 14% of participants met every single cutoff, every single threshold. So first I want to draw your attention to the graph on the left. And the orange bars here are those athletes that failed the test. They did not meet the threshold or the cutoff score. And you can see that the highest score for the orange bars of the people that failed was a pooled combined quadricep and hamstring strength. And the highest single failed test is quadricep strength in isolation. All of the blue bars are percentage of people that passed that. So again, going back to that pooled quad and hamstring strength, you can see nearly 75% of people didn't pass just the pure strength tests. Second thing I want to highlight here is looking at the graph on the right, you see a lot higher proportion of blue bars. So people that pass these functional hop tests, like our single leg hop or triple crossover hop, things like that. Now we don't want to neglect these tests. Certainly we think that they're still maybe valuable for a return to sport test battery. But what I want to highlight here is that it seems to be a lower bar, meaning these are easier tests to pass. And there have been a lot of studies this year that have looked at the contribution of the ankle and the hip to performance of these tests. So these things test function, they test hopping, they don't strictly test strength. You need an isolated strength test if you're going to test strength. All right, next one we're going to talk about, this is one that we really like to refer back to for those that are in the camp of we need to wait till at least 9 months before we're returning to sport. One of the key findings here is that for every 1 month of delay in return to sport, the re-injury rate was reduced by 51%. The other really important finding from this study is that for every 1 percentage point increase in quad strength symmetry, so if they go from 90% LSI to 91% LSI, there's a 3% reduced re-injury risk. And that's really, really significant. And that's just looking at quad strength alone, not any other factor. Next one looks at a really long-term follow-up, right? So this is a 5-year follow-up after an ACL injury. And what we're looking at here is how people with clinical OA do with a number of different variables. And again, they found that quad limb symmetry index was really the primary variable that was correlated with OA. So for every 1% increase in quad LSI symmetry index, there was a 4% lower odds of developing clinical osteoarthritis. I don't know about you guys, but I'm talking to my high school kids all the time about, the reason that we take this rehab and recovery so seriously is I want to make sure that in 20 years or so, I'm not seeing you because you're having your knee replaced when you're 45. We want to make sure that this OA doesn't sneak up on you. So hopefully, again, you guys came into this thinking strength is important, but if not, we kind of accept that moving forward. So key point number 2 is that we don't do a good job of measuring strength in really the orthopedic community. Most of the time, people just rely on manual muscle tests. And we've got a couple of studies that support that. These are both survey studies. This first one is looking at pediatric orthopedics, and they found that 60% only use manual muscle tests as their strength tests for return to sport decision making. Well, hopefully as PTs and physios, we do a little bit better than that, right? Well, really not that much. The rate was about the same in a very similar study or a very similar survey. So most of the time, people are just using these manual muscle tests and not using, a real objective measure. And this is kind of my visceral reaction to that. It makes me, a little bit queasy. All right. So then the question is, well, why is this the case? Why are we just using manual muscle tests? Well, and I think there are a number of barriers that are frequently brought up. The first is time. Honestly, to go through a good quality strength test using handheld dynamometry or an inline pull setup, really to test both quads and hamstrings takes 5 to 6 minutes. So honestly, I think that the time argument is really pretty negligible. As far as cost, certainly that could be a barrier, right? Not every clinic or setting can afford an isokinetic dynamometer. These are big pieces of equipment. They take up a lot of space. The cost is really, really high. $50,000 for one piece of equipment is a pretty hard line item in the budget to fit in. And this is the whole reason that we started Peak Force. We're trying to make this type of testing more accessible to more athletes. We got to get these re-injury rates down somehow and improve our outcomes. So we'll talk a little bit more at cost towards the end here, but really you can do these tests pretty inexpensively. And then functional tests, we talked about that a little bit earlier with that tool article. Functional tests have their place, right? But they measure specific things. They're not strength tests. You need to specifically measure strength if you want to know what strength is. Point number 3 is that relying just on manual muscle tests is a bad idea. These things were developed as strength screens, not true strength tests. And when we're talking about quads and hamstrings specifically, these muscles are just flat too strong for MMTs. We have a couple of studies that support this assertion. This first one is looking at an elderly group, mostly stroke patients. And what they did is they compared knee extension strength measured with a handheld dynamometer, so they got an objective number. And then they also tested those same people with MMTs. And their goal here is trying to determine, okay, which of the people with big deficits determined by handheld dynamometer could also be determined with differences on MMTs. So if you've got a big strength deficit, and in this case, more than 30%, they wanted to know, well, is MMT picking up on that big strength deficit? And they found that only 34 out of 47 of the times where there was a really big measurable deficit was the manual muscle test able to detect that big difference. This course is not about shoulders, but here's another example on the upper extremity where, really the manual muscle test was only able to detect a difference if there was a big deficit, in this case over 40%. I was interested to see how much actual force I could generate by doing an MMT, or how much force I could resist. So what I did is I set up my volunteer here on our Biodex in a position for an isometric strength test. And I pushed down as hard as I could, just like I would if I were testing knee extension MMT. And I found out that I can push about 105 foot-pounds. So what does that tell us? If I'm measuring somebody, in the clinic and I'm not using any sort of objective strength measure, what does my version of a 5 out of 5 MMT mean? Well, it could mean lots of things. Really, it could mean anything 105 or higher. It could mean perfect symmetry at 105 foot-pounds. It could mean perfect symmetry at 200 or 300 or 400 foot-pounds. Or it could mean a really big asymmetry that I'm not able to detect because my test is just not good enough to detect that. It doesn't go up high enough. Key point number 4 is using a handheld dynamometer, especially in an inline setup that's anchored, is reliable and it can be valid. So when we compare it to a gold standard test, if we're careful about the way that we set it up, it can be valid. These first couple of studies are looking more at reliability. So this is, like test retest reliability. And you can see that the values here are within, half a kilogram of force. So very, very similar when they retested the same subjects. This next one looks at intra and inter-rater reliability, right? So you can see all of the values here when we're using a handheld dynamometer to measure knee extension strength are, really plus or minus, half to 1 kilogram of force. So again, the reliability across these studies are all quite good. This one we're looking a little bit more closely at validity. How well does it compare to the gold standard isokinetic dynamometer? And you can see what they've done with the pictures up here in the top right is they've kind of set up the chair or the surface to be exactly the same. So they used a belt and an inline pulled dynamometer on the picture on the left, and then they swiveled the isokinetic dynamometer around on the right so that the subject is really in the exact same position for both tests. And then they compared the values across the two setups. What you'll notice is that the continuing theme with the next few studies is if you get the setup very similar, then the validity is actually quite good. So you can see that the values in this one are quite comparable, within 2 Newton meters, which is pretty negligible. The next study, very similar type of setup, right? So they compared, our standard setup for a Biodex with kind of a custom-made chair, but engineered to be in a very similar test position. And you can see from the scatter plots up in the top left that the correlation between the two tests is really quite strong. And then this is my favorite. They didn't even bother messing around with 2 different seat positions or 2 different chairs. What they did is they just strapped the individuals into the Biodex and then slapped the handheld dynamometer into the existing setup. So really it was an identical seated position. And you can see kind of up at the top right, 166 versus 170. Very, very similar. Again, we're talking about Newton meters here. Very similar findings for a group of 30 or so. So again, if you're careful about the way that you set these things up, then you can get even more information than just symmetry. So key point number 5 is that if you're interested in more than symmetry, then you need to really pay attention to detail. You got to pay attention to the seat position, the type of fixation, the joint angle, and making sure that your test is comfortable for your subject. Here's a couple of examples of, some things that I see commonly posted on social media. Now, if you're just purely interested in symmetry, this test over here on the bottom right is totally fine, right? It's going to be repeatable. It's going to give you a number that's very, that you can compare well side to side. The problem with it is if we're looking at the joint angle here, what are we eyeballing that at? Maybe 15 or 20 degrees of knee extension. When we know the length tension relationship of the quadriceps tells us that the strongest position for the quads is somewhere between 60 and 90 degrees. That's why we routinely test in these positions for isometric strength testing. We want to make sure we're testing at the strongest position. So if you want to look further than symmetry, then this is not a great test. And a lot of times when people try to set these things up on, a standard plinth, they'll think that they're starting at a knee joint angle that around 60, but then as soon as we start to apply some tension, they kind of end up in more of this position. For this picture up here on the top left, with using a pretty small kind of palm held handheld dynamometer in the base of their hands, if you do this with a strong enough athlete, you're going to end up with a broken nose because they're going to be able to push 200 pounds, and there's no way you're going to be able to resist that, and you're going to get a foot right in your jaw. So I certainly don't recommend that version because your athletes are just going to be too strong for that. All right, so if you're going to stop and take a picture of any slide, this is the one to do it. So we're going to talk about, all of the key points that you need to pay attention to. So starting from the top left, we want to make sure that we're in a chair or a surface that's elevated enough to get the foot off the ground. Your options here are just a standard chair, bolstered either with boxes, or in this case, we have Eric's. Other options would be like plyo boxes that have a hollow underneath it, right? So some space underneath. Or high-low tables are also good options. I don't generally like just standard plinths, more because it's tough to get the joint angle right. Next thing you got to pay attention to is how you fixate your device, right? So here I'm using the post of a power rack, making sure that I have, the hip anchored, so that we're not, lifting off with the hip. You'll notice if you're kicking hard with your quad, then the hip wants to come off of the surface. So we want to make sure that we anchor that down and that we're isolating everything as closely as we can. And then we've got, the ankle anchored as well. I wasn't done with that. Just go back. So the next thing you want to pay attention to is making sure that the test is comfortable, right? So both underneath the knee, if we can get to the right slide. There we go. Making sure that's comfortable underneath the knee and at the ankle, because if it's not comfortable, then the force value you're going to get is not going to be, the full capacity of what they can do. Number 4 on the bottom left down here, this is probably the most important one. You want to pay attention to your angles, right? So I generally advise people to shoot for about 90 degrees. And as you apply tension to the setup, you're probably going to end up more around 60. But start with the tibia straight up and down, and that's going to put you in a good position. Second thing you need to pay attention to is the line of force of your dynamometer or your force gauge, right? You want to make sure that it's perpendicular to your tibia, or else you're going to have to start to do some trigonometry, and nobody wants to do that. We've got enough math for this. Let's just leave that out of it and make sure it's 90 degrees. Next thing you got to do is measure the distance from the axis of rotation of the knee to the midpoint of the fixation strap. So that's going to give you your lever arm that you can multiply by, because what we're trying to do here is the device measures force, and if you want to get torque, which is what the Biodex measures, or any other isokinetic dynamometer, we need to multiply force times distance. What this does is it allows you to compare across populations, so we're looking a little bit further than symmetry. And the reason that's important is we want to, well, we'll talk a little bit more about why that's important, but first I want to just highlight quickly what the hamstring test looks like. Basically, you just flip the chair around and you're doing the exact same thing. Now, if we're going to get picky about this test, we would say that the fixation point over here is not ideal. That needs to be up a little bit higher so that we can be more perpendicular to the tibia like we discussed earlier. But otherwise, you're just going to flip the chair around, move the thigh strap a little bit closer to the knee, and then the tester may need to hold the back end of, if you're using something light like a chair or a plyo box, you might need to hold this down so that the tester doesn't pull the chair forward. Okay, so wrapping up, we're talking a little bit about data interpretation. So again, limb symmetry index is easy, right? As long as you have something repeatable, you can get symmetry. But if you want to look a little bit further and normalize these things to body weight to make sure that we don't have too weak legs, because symmetry just tells us, if they're similar side to side. It doesn't tell us anything about, the gross values, or if these are two strong legs or if we're talking about two equal weak legs. If you want that information, you need to convert force to torque like we talked about earlier. We need to multiply by the distance of the lever arm, and our target here is again 3.0 Newton meters per kilogram, or about 100% body weight if we're measuring in foot-pounds per pound. The analogy I use a lot of times with patients is this is kind of like power to weight ratio in a car. So what we really want is we want a big engine in a light car, like a Formula One car. We can get away with a big engine in a heavy car. We can get away with a smaller engine in a light car. What we definitely want to avoid is a small engine in a heavy car. And really, unless you're taking these torque calculations into account, you don't know if your symmetry is in this red box over here. This is not a commercial, but this is, my kit for this setup. Honestly, guys, we didn't start this company to get rich. We started it to get these tests out there. We want more people doing these things. So I'm going to break the first rule of business here and kind of highlight that I have competitors that can do this test cheaper. You can go and find one of these crane scales on Amazon for $50 or so. You just got to make sure that you get the one that holds the peak force. And, if you're crafty, you can probably improvise some straps. My kit certainly works for this, but what it was designed to do was bring this type of testing to really lots of other joints. So if you're just interested in quad and hamstring strength, you can certainly find this cheaper than what we do. All right, well, that about wraps up my talk today. I went a little bit longer than I intended to, but again, if you guys have any questions on anything we talked about today, feel free to reach out to me at any of these places, email, Instagram, Twitter. I'm available to answer any questions you might have. And if I leave you with one thing, it's that please, please, please make sure you're testing these athletes. Otherwise, you're just guessing and, kind of leaving them hanging out to dry. So please, test, don't guess.